To Health Matters Now, each year on 28th of July is observed to raise awareness of viral hepatitis, which causes inflammation of the liver that leads to severe disease and liver cancer. The world is currently facing a new outbreak of unexplained acute hepatitis infections affecting children. The WHO, together with scientists and policymakers in affected countries, are working to understand the cause of this infection that does not appear to belong to any of the known 5 types of hepatitis viruses, which include A, B, C, D, and E. In 2019 alone, an estimated 78,000 deaths occurred worldwide due to complications of acute hepatitis A to E infections. On World Hepatitis Day 2022, WHO is highlighting the need for bringing hepatitis care closer to the primary health facilities and communities so that people have better access to treatment and care, no matter what type of hepatitis they may have. Now, I have the public health expert Adegbami Oluwatobi joining me on the news to discuss more on the World Hepatitis Day. Thank you so much, Toby, for joining me.
Thank you for having me. Good morning.
Good morning. Now, Toby, today is World Hepatitis Day. First off, what exactly is hepatitis and how aware would you say that people are about this infection?
Okay. Good morning once again. Hepatitis is simply referred to as inflammation of the liver, right? And hepatitis is caused by, excessive alcohol consumption, excessive use of drugs, but most importantly, by hepatitis virus. Now, people are not aware of how deadly hepatitis virus can be. In fact, it's one of the reasons why it is called a silent killer. It's a silent killer because you might not experience any symptoms for a long time, all right? And by the time you start experiencing symptoms, it has already become too late. So why hepatitis is a silent killer is because you would not know unless you get tested. So that's why it's very important for everyone. If you are above, 15, I know we introduced hepatitis vaccine in Nigeria around 2004, but if you were born before 2004, we are making a lot of awareness around the country for everyone to get tested. Know your status first. It's the first step in making sure that you're safe from hepatitis. Know your status, and if you're negative, get vaccinated, and if you're positive, let's run further evaluations on you so that you can start getting treatment as soon as possible. That's
all right.
The hepatitis.
Okay, thank you for that, Toby. Now, from what we know, the world is currently facing a new wave of this infection, and that's different from the ones we have been familiar with in the past. And it's also found among both the children and adults. So what can you tell us about this new wave? I mean, from what we hear, it's different from the A, B, C to E. So what exactly is it about this new wave, and how dangerous is it?
Okay, so according to CDC, all right, this new wave, the source is still unknown, still under investigation. All right, but it is suspected to be caused by an adenovirus, right, that we have not identified before. Right, so work is still ongoing on it. But the ones that we have identified, the A to E, it is important that we begin to take actions in protecting people with the vaccines that are available. There's this school of thought that it's possible that if you are protected, you are fully vaccinated for the ones that are available, that you might still get some covering from the ones that we're not sure of what the source is yet. So let's give it some time. The investigation is still continuous. We might be able to find out the exact cause of the new wave of hepatitis.
Okay. Now, Toby, we know that the World Health Organization is hoping to achieve the elimination of hepatitis by 2030. That's in 8 years' time. And they have set some parameters to achieve that. So how close would you say that Africa is to achieving this next feat in the next 8 years?
I'm not going to lie to you. There's a long way to go, right? I'm saying that because I've been involved in this space for close to 8 years now. And every time we hold an hepatitis outreach, you find out that majority of our people are not aware. They don't know anything about it at all. And by the time we run some tests, and it's almost certified that a minimum of 10% of the population is hepatitis positive, and they're unaware. So I'm saying when we screen 10 people, you find one person that is hepatitis positive. When you screen 100, you find 10, minimum of 10, sometimes more, all right? It goes a long way to speak about the lack of awareness on this. And this is a good platform to inform, the general public and all Nigerians that if you have not gotten tested, if you have not gotten vaccinated, you need to take action, and you need to take action now.
Okay, talking about how viral this infection is, you just mentioned that 1 in 10 persons has this infection. What would you say can be done? Because you have mentioned also that it's important to raise awareness, but what would you say should be done or can be done to raise awareness?
Okay, so already for newborn babies, all right, within 24 hours, it's already in our national immunization program that they have to be vaccinated against hepatitis within 24 hours of birth. Okay, so that for children are being covered. Now, but for adults, we found out that the cases of liver cancer and illnesses related to hepatitis are on the rise. In fact, WHO says that 1 person dies globally every 30 seconds from an hepatitis-related infection. All right, so if that is not a global burden, right, I don't know what is. So in raising awareness, a lot of organizations, NGOs, private bodies are putting their weight behind hepatitis this season. I know that the Rotary Club of Nigeria is putting their weight behind hepatitis screening and awareness this season. I know that, of course, Emzor Pharmaceuticals is putting their weight behind screening and awareness. So now, across so many centers across the country, there are a lot of outreaches going on today where you can get tested for free. I can mention a couple of places in Lagos, in Yaba, in Tejo Market, in Festac, and where ACPN conference is going on right now. Emzor is running some free, testing for people to at least know their status and make a decision as regards protection. Now, people should get more involved. Individuals should get more involved. If you should test, get your immediate family to test. All right. In corporate organizations, some organizations are taking that corporate responsibility every year like that. They write to us, we screen their staff, all right, we let them know their status, especially those in the food industry, because the risk factor is high, and then the possibility of spreading to others too is high. So it's the step towards raising the awareness starts with individuals, all right? Be responsible for your own health, take responsibility for your own health, and then for the people around you. And let's continue to spread this message, because for now, we don't have a specific cure for this disease, all right? But there is a treatment, all right, management, all right, that is available for it. And it takes a long number of years to, you have to probably consider to take drugs for the rest of your life, okay? So, but the vaccines are so cheap right now that you can, walk into any hospital, get your test done, get vaccinated, and have that peace of mind. Right. And so, okay, thank you.
Thank you so much, Toby. It's great to know that effort is being made to create awareness and spread the message about hepatitis. Thank you so much, public health expert Adegbami Oluwatobi.
Thank you.